Okay, hello guys. As you can see, the topic that I have chosen to discuss with you all today is how genetics play a role in ADHD and what you would expect to find within that genic expression. So the first question that we want to ask ourselves is, what actually defines ADHD? What does that stand for? Well, ADHD stands for Attention Deficit Hyperactivity Disorder, and that can look very different for a lot of people. As you can see from the picture on the right, this can include characteristics such as forgetful, impulsive, they can become disorganized very easily, scatterbrained, things to that nature. There's also 3 different types of classification that ADHD falls within, all of which have to do with impulsivity, hyperactivity, and a combination of the two with attentiveness as well. So depending on where a person falls within that spectrum, they can have the combined type, they can have hyperactivity, impulsivity, or just inattentiveness. So diagnosing for ADHD is actually a very complex process and does require the attention of a professional. Typically it's done by a psychiatrist, and there is a specific method that they use to diagnose individuals. Basically, you have a list of all these different characteristics and or behaviors that a person can fall within. And the thing that is interesting about this is when it comes to hyperactivity, you need to have at least 6 or more of those traits to be considered hyperactive. Whereas the 2 pictures on the right, impulsivity and inattention, you need 6 or more of those traits, either or combined. And these basically are what classify an individual into having one type of ADHD versus another. So it's a very interesting way that people go about diagnosing this disorder. Some misconceptions and societal opinion, as well as issues with diagnosis. So some common assumptions that individuals with ADHD often hear that can be very frustrating to the individual are things like, why can't you just focus? Stop procrastinating? Were you even listening? Those are all things that people with ADHD hear very frequently. And the thing that I want to tell you all about this condition is that there's never a time when a person with ADHD is intentionally setting out to do these things. It's something that is just completely something that can't be helped. They can't control it. They're not intentionally trying to, act like they're disinterested or anything like that. And another common assumption that some people have is that people with ADHD or ADD and others, they have this conception that they're not as smart, and I just want to say that that's completely not true. In fact, there is evidence to suggest that people with learning disabilities actually have a higher IQ, upwards into the 130s. It's just that for those who have that disorder, it just means that maybe they have to work a little bit harder, or there's a certain area of focus that they tend to hyper focus on and that they're really, really good and passionate about. And then moving over into issues with diagnosis. So the problem is that a lot of people think that they have problems with focusing, and what this can tend to do is people tend to self-diagnose themselves And when you're in a conversation with somebody who has ADHD, it's very common to hear other people talking about that they have it too, just because they think they have one thing that they struggle with, which may be time management or whatever. But going back to one of the previous slides, there's multiple different behavioral characteristics that are required to meet the criteria of officially being diagnosed with it. And you often see parents that say that their child is too hyper, and they automatically make this assumption that they need to bring them in and get them evaluated, which sometimes is true, but sometimes not. And this can make it very difficult for people who actually have ADHD to get prescriptions, because there are so many people out there who go to these doctors, and these doctors are willing to just hand out this medication because the parents think that that's what's supposed to happen, and sometimes that's just not the case. Some genetic syndromes that are associated with ADHD. So I thought this was a very interesting topic when I was researching about this condition. More often than not, most people don't have multiple comorbidities in relation to ADHD, but for those who do, some of the most common other conditions that are seen with ADHD include autism, that's one of the main ones, obesity, bipolar disorder, depression, anxiety, and substance abuse disorder. Now, I just want to say that these comorbidities do not mean causation of ADHD. More or less, it shows commonalities in the risk of gene variants. And so these can often coincide with one another, but it doesn't mean necessarily that one causes the other. And when I was looking into the gene expression and how that controls the cognitive functioning, I found this to be very interesting. So the cognitive pathways are affected by these polygenic mutations, which basically that means that the complexity of ADHD from a allele perspective is so complex, and it's located on multiple different loci. It's not just one specific gene that researchers have been able to pinpoint exactly that indicate, yes, that person has it, or no, that person does not have it. It, in fact, is multiple different genes that they are coming to find out that are responsible for this. Specifically, the noradrenergic system is most impacted, which includes two different mechanisms behind that. So it affects the peripheral alterations in norepinephrine levels, as well as dopaminergic neurotransmission, which basically is just a disconnect in neurotransmission, which is controlled by a dopamine transporter protein, and I'll talk about that in just a second. So genic mutations associated with it, dopamine transporter gene is located on a gene specifically called the SLC6A3. And what they've been able to determine is this is a 40 base pair variant, with most commonly being anywhere between 9 to 10 repeated alleles located at the 3' region of the transporter protein here. So in terms of genetic mutations, basically what they have found is that there are numerous genes that code for certain things, and they're finding either deletions or multiple replications that have been found in these gene variances. So super interesting. And then lastly, two other genes that could potentially be responsible for ADHD is the dopamine D4 and D5 receptor genes. So some treatment options for this. The two most common are going to be MPH and dextroamphetamine, also known as DAMP. And both of these drugs block the reuptake of dopamine and norepinephrine into presynaptic neurons. So basically this increases the release of monoamines into a neural space. These are typically the most common drugs used to treat ADHD, and although it does typically tend to work with about 70% of people, there are that other 30% that do have to try to find other medications or other means to try to cope with dealing with this disorder. And lastly, the monoamine oxidase inhibitors, that is basically responsible for blocking the breakdown of serotonin, norepinephrine, and dopamine as well. So as you can see, dopamine really does play a key role here in the gene expression of ADHD and how that can affect a person's daily tasks of living. And basically that concludes my presentation on ADHD. Here are the references that I use below. Thank you guys so much for listening, and please feel free to ask me questions, as this is a very interesting topic for me, and I'd love to be able to discuss or recommend any articles or videos for you to watch. Thank you.